Now we move on to wearable devices. Wearable devices are devices that are smart, that monitors our activities and our biometrics by using it on our body. These are very useful to help healthcare providers and carers and for the individuals to know the state of health and well-being. Activity tracking devices are common in most watches and activity trackers, and they have certain algorithms that help us to motivate us for physical activity. They help us know our state of affairs. There can be sensor devices, and they have sensor fusions so that they have gyroscopes, accelerometers, heart rate monitors, and even blood sugar monitors. They have advanced algorithms to help them decide and make decisions on what is healthy and what is not well. And it also gives a lot of information, personalized insights to the individuals to help them stay healthy, improve their well-being, and also alert them to any health deterioration. These devices also, in the presence of the accelerometer, helps detect falls, and this can be useful, especially if they fall and they lose consciousness. It can send signals and alarms to the caregivers, and this is vitally, especially for elderly who live alone, and the technical complexities requires much more sophisticated devices, which may be expensive, but with continued usage among individuals, the price will drop. And however, there is a danger of data infringement. However, one has to balance between the importance of the clinical and health importance as those against data infringement. So the important thing is for those who design these wearable devices to take into consideration the various individuals and their biophysical status when they design. They has to be very ergonomical, lightweight, and sometimes even be stylish, as some of the elderly are very conscious about style and fashion. The user experience is very important. It cannot be so difficult and complicated, as the elderly do have challenges in using technological devices. So the preference to voice activation, simple touch, and these would increase the user experience and therefore the usability of these devices. They have to be power efficient, as these need to be regularly be charged, making sure the battery life is sufficient to last for more than a day. That makes it much more pragmatic for use by the individuals. Data privacy and security concerns are always there. So this is where the data collection, the wearables must be remain on the device, and then the calculated algorithms are then moved to the cloud so that no identifiable data is kept in the clouds but is kept on the device, and the decisions that are made in the cloud, the algorithms, are then sent back to the device, and then it is locked with the personal data. Cybersecurity risks are always there, and it's very important to isolate certain sensitive data from the wearable device. Regulatory oversight is important, and this is where, because of the industry expansion and the flooding of the market with these devices, that the local regulatory framework needs to ensure that they are registered and that there is an oversight. And the user awareness of these possible risks must be educated and trained, just not through leaving it to the individuals to find out. So the vendors need to ensure that the users have trained in these aspects. User experience is important, and you must also understand that the cost has to drop, and this is where the functionality and the cost needs to be worked out carefully, and this can be worked out with various pricing models. And the simplicity of use has to be taken into account, because these are not tech savvy individuals who are users. The elderly needs to have simplicity in the user interface, and the value must be perceived to be useful to each of these individuals to adopt this. And this is where training is required, and once they can see the value of their device to their personal life, and then they will adopt this, and this will therefore improve their well-being. And here's where healthcare providers need to train and educate their elderly patients on the value of technology and to help them in their healthcare and in their wellness. So what are the emerging trends is the biometric sensors will now start to screen for other things, including using nanoparticles to detect the early detection of disease, and the seamless integration to electronic health records would be the next step, and therefore there is a continuous monitoring of the patient's well-being in the health record, which then empowers healthcare providers to provide more personalized healthcare and also go into predictive analysis of the patient's future well-being. And the use of augmented reality devices like the glasses, smart glasses, can help collect data on what the individuals are doing, what they are eating, the environment, and alert healthcare professionals of any dangers or any advice that needs to be provided due to what the data that is showing. So the future of wearable technology is phenomenal, and I think it's from monitoring of healthcare to monitoring of biometrics, is also to engage them in social engagement with others through the use of augmented reality to travel the world and keep cognitive health well-being among themselves.